Carpal tunnel syndrome is a common condition in which pressure is put on the median nerve, a nerve located in the wrist. Symptoms that this is occurring include numbness, tingling, and burning in the palm, thumb, middle finger, and ring finger. You may also feel clumsy, drop things often, and experience a change in your sense of touch. Oftentimes these symptoms are experienced in the middle of the night, though they're commonly felt while doing work that puts stress on the wrist and fingers as well. Over time, you may experience sharp pains with each movement of your wrist and fingers. Does this sound like you? If these symptoms seem familiar, it's best to see a doctor about them right away. Many patients in the newer stages of carpal tunnel syndrome tend to put off seeing their doctor, as they dismiss the tingling numbness as simply due to their hand falling asleep or poor circulation. As the beginning symptoms are fairly brief, however, it's also easy to mistake them for other problems. However, treating carpal tunnel syndrome in its early stages can help enormously when it comes to preventing the more painful and drastic effects of this disease. Left untreated, your mobility and sense of touch might worsen, and you may find that the numbness and tingling last longer. Over long periods of time, permanent nerve damage can occur as well as deterioration of certain muscles. There are many different treatments for carpal tunnel syndrome. Some doctors recommend using office equipment that is easier on your wrists, such as specialized keyboards and foam wrist pads. Others believe carpal tunnel syndrome can be treated by wearing wrist braces. These will keep your wrists straight during times when they would otherwise be bent at a damaging angle. Such as for more severe cases of carpal tunnel syndrome, your doctor may recommend the use of steroid injections in an attempt to lessen the pressure. The only downside to these treatments is that it isn't wise to use any sort of steroid over long periods of time, so dosages are usually quite brief. He or she may also have you perform therapeutic stretches or exercises or take vitamins or omega-3 fatty acids. However, if all procedures have failed to create any sort of relief, surgery may be necessary to prevent any further damage. Carpal tunnel surgery usually isn't a big ordeal. In most cases it simply involves slicing certain areas of the wrist and palm to relieve the pressure. To learn more about this simple procedure and other treatment of carpal tunnel syndrome options to consider, visit http Carpal Tunnel Syndrome TK website today. You may also want to learn more here. http Carpal Tunnel Syndrome Carpal Tunnel Syndrome